My name is Daya, and I'm from the University of Colorado, Anschutz Medical Campus. My work focuses on understanding how genetic makeup influences risk for developing common allergies, such as asthma and eczema and hay fever. And to do this, I've had to use whole genome genetic data collected by various studies over the past few decades. And then together with measurements of a really important marker for allergies, total serum IgE, I'm able to study if there's genetic risk factors that make you more prone to allergies. So I think the most significant outcome of my work was showing that genetic loci of allergy discovered by previous studies, which was largely done in populations of European ancestry, those results are actually relevant in other population groups, particularly African ancestry and Hispanic Latino population groups. Being a BioData Catalyst Fellow was really a great experience. I had convenient access to large genetic data sets. I could very easily run analysis using some of the tools available on the platform. There are many tools on the platform. And that meant I could spend my time on interpreting results rather than writing those tools to do the analysis. With that being said, for the more custom analysis, I could also very easily write my own tools and run that on the platform. And I could easily share that with other people that I work with. Scientific questions that I've been able to help answer with BioData Catalyst include showing that allergic disease genetic loci discovered by previous studies done primarily in population of European ancestry. They are really also relevant in African ancestry and Hispanic Latino population groups. I've also been able to look more closely at the relationship between human leukocyte antigen genes and levels of total serum IgE. One of the aspects of my study was to use whole genome sequence data to determine which human leukocyte antigen allele a person carries. So this type of analysis is very costly in terms of storage, in terms of CPU and memory, and without BioData Catalyst resources, it really would have been practically very hard to do this, and it would have taken much longer. One of the things that's really important in science is reproducible research. And one of the best aspects of working in BioData Catalyst is that I have much more confidence that the analysis I have done can easily be reproduced by others. So rather than recommending that individuals adopt BioData Catalyst, I would actually strongly encourage academic research institutions to really adopt the platform and to encourage their students, staff, and faculty to use it. And that's because I think that federal research money would really go much further if institutions adopt cloud computing. You only pay for what you actually use. So actually in the long term, I think it's more cost effective. And then one of the major additional benefits of moving to BioData Catalyst specifically is that all of those technical details of moving analysis to the cloud has already been taken care of. I think engaging with the BioData Catalyst community has been great. So we've had monthly fellow meetings. Those are typically interactive and people are able to ask questions that really help resolve some issues that they have maybe on the platform and move forward quickly. So it's the perfect combination of being able to get help when you need it and contribute and give ideas, but it's also not onerous. So it's not like you're expected to attend thousands of meetings and all of your time gets sucked up and you have no time to actually do any of the work. It's like the really well organized and a pleasure to engage with the community.